Temple Grandin, one of the most accomplished animal scientists in the world, designs livestock facilities used across the United States. She is also autistic. Grandin attributes her ability to think in pictures, a characteristic of her autism, as the source of her ability to intuitively understand how animals perceive environments. The neurodiversity framework asks, what if some neurological differences are not deficits, but different modes of processing the world? Attention deficit hyperactivity disorder is a neurodevelopmental condition characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with functioning across multiple settings. The DSM distinguishes three presentations: predominantly inattentive, predominantly hyperactive impulsive, and combined. The inattentive presentation involves sustained attention difficulties, distractibility, disorganization, and forgetfulness. The hyperactive impulsive presentation involves excessive motor activity, inability to remain seated, talking excessively, blurting out answers, and difficulty waiting. Most children with ADHD show symptoms of both presentations. ADHD is among the most heritable of all psychiatric conditions, with heritability estimates of 70 to 80% from twin studies. Neuroimaging consistently shows reduced gray matter volume and thinner cortex in prefrontal areas responsible for executive function, working memory, and inhibitory control, and slower cortical maturation trajectories that partially normalize by adulthood. Dopamine and norepinephrine dysregulation in prefrontal circuits is the most well-supported neurochemical model, explaining why stimulant medications that increase catecholamine availability are the most effective pharmacological treatments. The MTA study, the largest randomized trial of ADHD treatment, found that stimulant medication produced the largest improvement in ADHD core symptoms. Behavioral therapy alone produced meaningful but smaller benefits, and combined treatment produced the best outcomes across measures including parent-reported behavior and social skills. Methylphenidate and amphetamine salts are the primary stimulant medications, working by blocking reuptake and increasing release of dopamine and norepinephrine in prefrontal circuits. Non-stimulant options, including atomoxetine and guanfacine, are used when stimulants are contraindicated or ineffective. Autism spectrum disorder is a neurodevelopmental condition characterized by two core feature domains: persistent differences in social communication and interaction, and restricted, repetitive patterns of behavior or interests. Social communication differences include challenges in back-and-forth conversation, reduced sharing of interests and emotions, and difficulties understanding and using nonverbal communication. Restricted and repetitive behaviors include stereotyped movements, insistence on sameness, intense focused interests, and unusual sensory responses. The spectrum encompasses a wide range of ability levels, from individuals requiring substantial support to highly independent individuals with narrower social challenges. Autism spectrum disorder is highly heritable. Concordance in identical twins is approximately 70 to 90% and involves hundreds of genetic risk variants, each contributing a small effect rather than a single causal mutation. Environmental risk factors include advanced parental age, prenatal exposure to certain medications like valproate, and possibly maternal immune activation. The claim that vaccines cause autism has been comprehensively refuted by studies involving millions of children across multiple countries. The original 1998 Wakefield paper was fraudulent and was retracted, and Wakefield lost his medical license. The neurodiversity framework, advocated by autistic scholars and activists, proposes that neurological differences like autism and ADHD are natural forms of human cognitive variation rather than disorders to be cured. Proponents argue that the disability experienced by autistic individuals often arises from the mismatch between autistic neurology and a social environment designed by and for neurotypical people, not from autism itself. Accommodation and acceptance, rather than normalization, are the preferred goals. The neurodiversity perspective has influenced disability policy, educational practice, and increasingly clinical approaches, though it remains debated in relation to profoundly disabled individuals who require intensive support. Applied behavior analysis uses operant conditioning principles to teach skills and reduce problematic behaviors in autistic individuals. Modern ABA focuses on positive reinforcement, naturalistic learning, and child-directed goals, building communication, daily living, and social skills. Studies show that intensive early ABA produces significant developmental gains. However, ABA has a controversial history. Earlier versions used aversive procedures and attempted to eliminate autistic behaviors like stimming that many autistic people regard as benign and natural. Contemporary advocates call for ABA that is informed by autistic perspectives and that does not aim to make autistic people appear neurotypical. Evidence-based accommodations substantially improve educational and occupational outcomes for individuals with ADHD and ASD. For ADHD, extended time on tests, frequent breaks, reduced distraction environments, and explicit organizational scaffolding address the executive function limitations rather than requiring the individual to overcome them through willpower. For ASD, predictable routines, advance notice of transitions, sensory accommodations, and explicit instruction in social expectations allow autistic individuals to demonstrate their abilities rather than managing environmental demands. Accommodation is not lowering standards. It is creating conditions where the standards can actually be met. ADHD and autism spectrum disorder are among the most common and most researched neurodevelopmental conditions, and our understanding of both has been transformed over the past 3 decades. The neurodiversity movement has challenged the medical model's exclusive deficit focus, and the truth, as with most complex issues, lies in integration, recognizing genuine differences and associated challenges while also recognizing genuine strengths and valuing neurological diversity.